Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Heart failure. Introduction. Heart failure, also known as congestive or chronic heart failure, is commonly referred to as CHF. It is a common condition that affects millions of people worldwide. Although it is more common in older people, heart failure can happen at any age. Heart failure can lead to serious health problems, including death. Treatment can help control symptoms and prevent complications.
This program explains congestive heart failure. It covers symptoms and causes of the condition, as well as treatment options. The heart. The heart is responsible for pumping blood to all of the organs in the body. It is a muscle that is expected to work continuously for a lifetime. The heart has a right and a left side. Each side has two chambers, the atrium and the ventricle. Special valves divide the chambers and prevent blood from flowing backward. Blood loaded with oxygen comes from the lungs and enters the left atrium. It stays there until the mitral valve opens up and the atrium contracts. This forces the blood into the left ventricle. The blood is then pumped to the rest of the body through the aortic valve into the aorta. The aorta is the largest blood vessel of the body. After the blood circulates throughout the rest of the body, it returns to the heart through the right atrium. From there, it is pumped into the right ventricle through the tricuspid valve and then to the lung through the pulmonic valve. In the lung, the blood picks up oxygen and returns to the left atrium where the whole cycle starts again. The heart needs a continuous supply of oxygen and sugar to be able to function. Oxygen-rich blood is delivered to the heart through the coronary arteries. These arteries branch off from the aorta. Heart failure. Heart failure is a condition that happens when the heart is not able to pump a normal amount of blood to the rest of the body. A healthy heart pumps 50% of the blood in the ventricle in one beat. A failing heart pumps only 40% or less of the blood in the ventricle in one beat. There are two types of heart failure. 1. Systolic dysfunction, a heart failure wherein the heart muscle becomes weak and the heart enlarges. When the heart muscle is weak, it is not able to pump with enough force during a heartbeat. Therefore, less blood is pumped from the heart. 2. Diastolic dysfunction, a heart failure wherein the heart muscle becomes stiff. When the muscle is stiff, it is not able to relax between heartbeats. The ventricles are unable to fill with enough blood. Therefore, less blood is pumped from the heart. A person may have only one type or both types of heart failure. When the heart cannot pump all of the blood it receives, extra fluid could back up into the lungs and other parts of the body. Symptoms of heart failure happen because of the buildup of fluids and the lack of blood being supplied to the rest of the body. When fluids collect in the lungs, it is called congestion. That is why this condition is called congestive heart failure.
There are several levels of heart failure symptoms: mild, average, severe, very severe. Very severe heart failure may cause a person to be short of breath or feel fatigued even when they are resting.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Symptoms. One of the first signs of heart failure is weight gain. It can be either sudden or slow and gradual. The weight gain is due to buildup of fluid in the abdomen, feet, ankles, and legs. People with heart failure may feel tired and short of breath when they do things that are normally easy, such as climbing stairs or eating. As heart failure gets worse, a person becomes completely disabled. They may lose their ability to walk. Fluids may build up in the upper body, such as in the lungs and abdomen. People with heart failure will feel short of breath as fluids build up in the lungs. If this happens while they are sleeping, the person may wake up due to a choking feeling. It is hard for most people suffering from heart failure to lay down flat in bed. They may need to sleep with their head raised up on several pillows.
As fluid builds up in the lungs, chronic heart failure patients typically develop a cough that doesn't go away. This cough may bring up mucus or blood. Call your healthcare provider if you have chronic heart failure and you experience increased swelling of your feet, legs, or abdomen, needing more pillows or sleeping in a recliner, sleeping problems such as waking from sleep to catch your breath, sudden weight gain, worsening shortness of breath.
You should also contact your healthcare provider if you experience new or worsening dizziness, a cough that does not go away, new or increasing irregularities in your heart rate, problems with heart failure medications. Additional signs and symptoms to watch out for and report to your healthcare provider are less than usual amount of urine, poor appetite, slower ability to think, low blood pressure, cool hands and feet. Ask someone to drive you to the emergency room or call 911 if you experience severe shortness of breath, a cough that brings up pink and frothy mucus, chest discomfort, pain or pressure that doesn't go away after you rest or take nitroglycerin. Causes. Heart failure can happen at any age, but it is more common in older people. Our hearts become weaker and our blood vessels get narrower as we age. Heart valve diseases can also cause heart failure. The blood may leak back through a defective valve, causing the heart to work harder and blood and fluids to build up in the lungs. Hypertension or high blood pressure increases the workload of the heart over time. This can lead to heart failure. Coronary artery disease can cause heart failure. Coronary artery disease develops when fatty materials deposit in the coronary arteries. This causes the blood vessels of the heart to become narrow and clogged. The first sign of coronary artery disease may be chest pain called angina. A heart attack can happen if an artery becomes completely blocked and the blood supply to an area of the heart is stopped.
Heart attacks may cause heart failure. Because part of the heart muscle is damaged in a heart attack, the heart pumps less effectively. This can lead to chronic heart failure. The heart may weaken if it is infected or inflamed. This is called cardiomyopathy, and it may also lead to chronic heart failure.
Other causes of heart failure include cancer treatment, radiation, and certain chemotherapy drugs, diabetes, HIV/AIDS, thyroid diseases. Other causes of heart failure include alcohol abuse, the abuse of cocaine and other illegal drugs. Heart failure can happen to anyone, but it is more common in people who are 65 or older, African Americans, males. Congenital heart malformation can cause heart failure in young people. Congenital heart malformations are abnormalities of the heart and major blood vessels that patients are born with. Surgery is often needed to fix these abnormalities. Diagnosis. To diagnose heart failure, healthcare providers ask questions about the patient's personal and family health history. They will also perform a physical exam. Tests that may be done to diagnose heart failure include blood tests, chest X-ray, echocardiogram, electrocardiogram, or ECG. Other tests that may be done to diagnose heart failure include angiography, cardiac catheterization, Holter monitoring, stress tests. Treatment options. Heart failure is a chronic disease that needs lifelong treatment, but treatment can help improve symptoms of heart failure and help the heart become stronger. Heart failure is usually treated with a combination of medications. The medications that are used are based on the type of heart failure the patient has and how severe it is. The main medications used to treat heart failure include diuretics, ACE inhibitors, aldosterone antagonists, angiotensin receptor blockers. Other medications that may be used to treat heart failure include beta blockers, isosorbide dinitrite hydralazine hydrochloride, digoxin. Patients should tell their healthcare providers about any medications they are currently taking, including non-prescription medications, vitamins, or dietary supplements. Healthcare providers will explain the possible side effects of prescribed medications to patients. Prescribed medications can have some serious side effects. Ask your healthcare provider about specific side effects that may be caused by the medications you are prescribed. Contact your healthcare provider right away if you experience any side effects. Treatment in a healthcare facility may be needed for severe heart failure. In the hospital, new medications may be given. Some people with severe heart failure are given intravenous or IV drugs. These medicines are injected directly into a vein in the arm. Extra oxygen may be prescribed if breathing problems are not controlled by medication. The extra oxygen can be given in a healthcare facility or at home. As heart failure worsens, lifestyle changes and medicines may no longer control heart failure symptoms. You may need a medical procedure or surgery. A pacemaker may be implanted near your heart. This device helps both sides of the heart contract at the same time, which may decrease heart failure symptoms. An implantable cardioverter defibrillator, or ICD, may be implanted. ICDs are similar to pacemakers. The device checks your heart rate and corrects heart rhythms that are too fast. Children or adults with persistent congenital heart problems often have heart surgery. Surgery can help correct the abnormalities and prevent or improve heart failure.
If a person develops plaque buildup in the coronary arteries, a coronary artery bypass surgery may be needed. A surgeon will bypass the coronary arteries that are partially blocked by plaque buildup with healthy blood vessels from another part of your body.
People who have heart failure symptoms at rest despite other treatments may need a mechanical heart pump, a heart transplant. If hospitalized, your nurse will review your discharge instructions before you leave the healthcare facility. Following your discharge instructions will help you to manage your heart failure more effectively. Before you leave the healthcare facility, make sure you understand your healthcare provider's recommendations about your medications, weighing yourself daily, diet and fluid restrictions, the activity level that is right for you, your follow-up appointments, what to do if your symptoms get worse. Lifestyle changes. Your healthcare provider may recommend a reduced sodium diet. Talk with your healthcare provider about how much sodium is right for you. Sodium, or salt, causes fluid to build up in the body. By reducing the amount of salt that you eat, you can reduce swelling and fluid buildup in the lungs.
Eating a healthy and balanced diet that is rich in fiber and low in saturated and trans fat can also help control symptoms of heart failure.
Be physically active. Talk to your healthcare provider about the type of activities that are right for you. Heart failure usually affects the level of activity that is safe for most patients. Losing weight if you are overweight can help control symptoms of heart failure and prevent complications. Check your blood pressure regularly. If it is high, keep it under control by avoiding foods that are high in salt and taking prescribed medication. You should also check your cholesterol and blood sugar levels regularly. If you smoke, quitting can help you control heart failure and prevent complications. Do not drink alcohol or use illegal drugs. Getting enough sleep at night and resting frequently during the day can also help control symptoms of heart failure. Learn to manage stress through meditation, exercise, or other methods.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Heart failure is a condition that happens when the heart is not able to pump a normal amount of blood to the rest of the body. Symptoms of heart failure happen because of the buildup of fluids and the lack of blood being supplied to the rest of the body. When fluids collect in the lungs, it is called congestion. That is why this disease is called congestive heart failure. One of the first signs of heart failure is weight gain. It can be either sudden or slow and gradual. The weight gain is due to a buildup of fluid in the abdomen, feet, ankles, and legs. People with heart failure may feel tired and short of breath when they do things that are normally easy, such as climbing stairs or eating. As heart failure gets worse, a person becomes completely disabled. They may lose their ability to walk. Ask someone to drive you to the emergency room or call 911 if you experience severe shortness of breath, a cough that brings up pink and frothy mucus, chest discomfort, pain, or pressure that doesn't go away after you rest or take nitroglycerin. Heart failure can happen at any age, but it is more common in older people. Our hearts become weaker, and our blood vessels get narrower as we age. Heart valve diseases can also cause heart failure. The blood may leak back through a defective valve, causing the heart to work harder and blood and fluids to build up in the lungs. Heart failure is usually treated with a combination of medications. The medications that are used are based on the type of heart failure the patient has and how severe it is. Lifestyle changes, such as losing weight, exercising, and quitting smoking if you smoke, can also help control congestive heart failure. Thank you for using Explain.